So I lead our regional business and workforce engagement organization here at MetLife, and with that, I run our P&L and L, and I oversee our sales organization, service, underwriting, operations, and strategy for our regional business. And really, that's our business that provides our global benefit solutions for U.S. based employers that have between 2 employees and 5,000 employees. I also run our PEO segment, so the professional employer organizations business, which is largely centralized business that focuses on providing, as you know, HR type services to small businesses. And we have a centralized business that focuses solely on that PEO business.
Can you give us a sense of the scale? Like, I don't know, whatever you feel comfortable sharing that's public information, number of clients or
Sure.
turnover as it
Yeah.
relates to small business clients specifically.
Sure. We have a dedicated team of small business experts, and in that team, we do business with over 35,000 small business employers that we define as employers that have under 100 employees here in the U.S.
And thinking about those small businesses and your services, what do you offer them specifically?
Yeah, so at MetLife, we're in the group benefits business here in the U.S. and we work with employers of all sizes, and so we work with the largest employers in the U.S. as I mentioned before, some of the smallest employers. And what I like to say is we have that unique ability to offer Fortune 100 benefits to the smallest of employers in a way that makes sense for them. And so we offer a wide array of industry leading benefits in easy to understand bundles um, with savings and discounts and easy to implement, easier to administer. And these are things like your traditional life insurance and long and short term disability type plans, dental insurance, vision insurance, as well as key voluntary benefits programs. Think accident insurance, hospital indemnity insurance, critical illness, cancer insurance, as well as a lot of growing voluntary benefits that have become much more prominent in the last few years, like group legal programs or even pet insurance, which we started offering over the last couple of years.
Okay. So we're here today to talk about innovation as it relates to insurance products and services for small businesses. How do you think about insurance innovation? How do you prioritize topics or themes that you think are the most beneficial or the most interesting to your clients, let's say over the next year or two?
Yeah, so I talked about some of the benefits that we're offering, and we really focus here at MetLife in the non-medical space. And one of the areas that we have been focused mostly on over the last few years is our end-to-end operating platform. And I just talked about the array of benefits that we offered. And at the end of 2023, we began scaling our new modern operating platform. And what that is our ability to have quote to claim um, in one operating platform that has built for and is geared towards the small business employer. And so when it comes to our focus over the next year or two, it is continuing to scale that platform, meeting the needs of small employers. And it's everything from we know that what's most important here is ease and simplicity. And so it is built with self-service platforms or portals, I should say, that are 24/7 in access that allow small business owners and teams and their, as well as their employees to access at any and all times things like viewing claims and paying bills and making change to their employee workforce demographics, as well as we know implementation or setting up new plans or onboarding um, needs to be simple. And we're very pleased that consistently we're seeing over 90% of our new plans being done in less than 7 days. And so that continuing to meet the needs of small business employers and their brokers and consultants, and continuing to scale that platform with more and more employers and keeping that level of satisfaction and ease is top of mind for us.
It's hard to talk about anything but Gen AI today when it comes to innovation. Does Gen AI feature in any aspect in your day to day or your platform or services that you extend to your customers?
Yeah, we know our customers are focused here, and as are we at MetLife. We also know it's important balance that in the ability to generate efficiencies or improve the customer and the employee experiences, but that balance with the importance of cybersecurity, privacy, risk, and the aspect of protecting our customers' data and privacy is always top of mind for us at MetLife, and it's the highest priority for us. And so it's really probably not the best time for us to get into the specific details of our AI strategy. But what I will say, it's a focus of ours. And we are actively using AI use cases and tools within this business right now, and we're going to continue to do that go forward. And when the right time is, we'll be happy to share some details around that into the future.
So you mentioned the innovations you're already doing in terms of the platform, but what are some other unmet needs that small business customers are looking towards their insurance provider to help them satisfy when buying or procuring insurance in general?
Sure. So I'll take it in two different pieces. First, you think about the small business employer, and first from the employer lens. So, through our research, we see some of the biggest pain points today are related to the challenges stemming from the macroeconomic environment. So, rising medical and healthcare costs or pharmacy costs, and the uncertainty around financial conditions and the policies, creating a real set of unease for these business owners and these employers. And then you take the employee lens, and small business employees are no exception to that. And as a matter of fact, they're experiencing higher levels of stress, and they're exhibiting lower levels of engagement and productivity at work as a result of that. And every year at MetLife, we do an employee benefits trend study. And the 2025 study that we released in March told us that employee holistic health and productivity are actually on a decline across the United States in the workforce. And it's especially acute among small business employees. And that's driven by the similar factors that macro challenges and these economic concerns. And small business employees told us that they're less financially healthy, they're less satisfied with their employee experience, and they're less able to take advantage of their benefits compared to what all employees from all size employers told us in the same survey with these same questions. And all employees are turning now to their employers for help. And the challenge that small business employees have and small business employers have is they often don't have these robust HR teams to help and to navigate these complex benefits administration programs. And so from that, that's where we see MetLife as a real ability to help, not only to help employers with crafting benefits plans and programs that make sense and get at what they're trying to solve for their demographics, but also what we often call the employee confusion gap, which is how do I, as an employee, understand which of these benefits. First, what do they do? And how do I understand and connect what the benefits I'm being offered to the needs that my family has? And how do these benefits help fill that need? And then when I enroll and select these benefits, how do I ensure that I'm using them throughout the year and remember to use them throughout the year? And MetLife has spent a significant amount of our time and our research and our energy really building out tools and resources to help our employers of all sizes get at that confusion gap and providing resources and tools for our clients to either assist them with communication engagement of their overall benefits plan or take on some of that work effort for them if they don't have these robust teams of resources to help, especially in the small business market.
Isn't that a little bit counterintuitive? Wouldn't it be beneficial for you to have customers that never use your services, just pay the annual fees? Wouldn't it be good if you could bury some of those benefits? What's the thinking there around helping them to effectively get more out of their insurance?
Yeah, not at all. It's actually the opposite, and it comes to the value of benefits. If you think about an employee and enrolling in benefits, I would say twofold. One is if I enroll in benefits and I don't use it, next year comes around and I'm looking at benefits and I'm looking at, especially at a time where I may be wondering and thinking through every dollar I'm spending. and I'm looking at this certain benefit I have, and if I haven't used it, my likelihood in wanting to retain it is diminished. And so using benefits is actually what we find in our data ensures that they're actually seeing value in it and therefore keeping it year over year. And then talking about it at work and helping others to understand that not only was this benefit valuable to me and my family, here's how I used it. So it's another avenue of educating others in the workforce about the benefits that are being offered. So we actually see the opposite, and we see that by in helping individuals not only understand what benefits are and how to connect them to their own personal needs, but then helping them understand how to use them throughout the year at the right times when they see these use cases come up, connects the dots and continues them to want to stay in the programs throughout the year because they see real value.
You mentioned sort of the increasing cost and staying on the small business employer side. How do you think about pricing or helping them to pay for premiums, bundling coverage, etc.? Do you have any specific strategies or thoughts around that?
Yeah, I think so. I talked before about how MetLife has a wide array of many products that we offer in the non-medical space, and bundling is really important, especially in that small employer market, and not only from a standpoint of costs, but also that ability to do more with fewer. So to streamline administration at the same time of helping with overall costs, and talked about how our research had shared with us that employers are focused in here, and it's a stress on their minds right now is the overall financial costs associated with healthcare and other costs associated with inflation. And cost containment will become more important and is already today important as it relates to benefits and benefit strategy. And what we often see is that then tends to sometimes mean where employers are looking at their benefits dollars, and is there an opportunity to shift some of those benefit dollars from employer provided benefits to more and more employee contribution or voluntary benefits? And as I mentioned, MetLife has a wide array of voluntary or employee funded benefits, and we include those in our bundles. And so there's a real opportunity for MetLife to help an employer by bundling a package of both employer sponsored as well as voluntary employee benefits into a bundle that can help an employer contain overall benefits costs. But at the same time, when you're offering choice to employees, our research shows us that the perception of the overall benefits program increases. And therefore, the value of what that employee feels about what they're being offered increases at the same time. So that's where we see an opportunity to help control costs through voluntary benefits to the employer while helping to increase the value and the perception of the benefits being offered in the package at the same time.
Brad, thank you very much for your insight. Appreciate that and your time. Thank you.
Thank you very much, Chris.